So that's kind of a little bit about lung cancer and our program. But one of the things is if you don't have lung cancer, you haven't been to the cancer center to be treated for lung cancer, what are some prevention? What are some things that we can do as a prevention to not get lung cancer?
I'll take first crack at this. So, a couple major things. Obviously, smoking. I mean, and smokeless tobacco. That really, folks think, well, if I'm not smoking, I'm just using dip. That the same carcinogens are getting into your system, and smoke is not just lung cancer, but it is oral cancers, head and neck, throat cancers, esophagus cancers, swallowing tube cancer, kidney cancers, bladder cancers, because that's how your body gets rid of those carcinogens within the bloodstream. So if you smoke, please quit. If you don't smoke, don't start. If you have been a smoker in the past, consider low-dose CT lung screenings. That's the equivalent of like mammograms for breast cancer, where on a serial basis you'll have a CT scan of your chest and look for small pulmonary nodules when that lung cancer is potentially curable, rather than a couple years ago when we would find lung cancer, they were most often in the late stages and not as easily cured. Colonoscopy, if you're over 50 or have family history, you may need to go earlier, but colonoscopy, it can prevent colon cancer, how does it do that? By finding it when it's a small polyp, and if they remove that polyp, it doesn't exist anymore, doesn't have the chance to turn into a colon or rectal cancer. Mammography for women and keeping a good and healthy weight and lifestyle can also decrease risk for cancers.
There's a number of different reasons why we should try to adopt a healthy lifestyle, not only just to help with our weight control for the way that we feel about ourselves, but it helps prevent a number of diseases, including cancers. So, adopt a healthy diet. If you're not familiar with the new model that we have that has replaced the food pyramid, it's called MyPlate, and it's a really great representation of what a typical healthy diet would be for individuals. And so from that, I think someone's holding that up in the back if you want to look. But from that, we can see visually ways that we can make improvements, increasing intakes of fruits and vegetables, whole grains, lean meats, limiting the amount of sugar that we take in from desserts and sweets. And with that, if you have conditions like diabetes, try to get them controlled. Make sure that you're not having high blood sugars, too often, that you're trying to manage that well. And that can help with just keeping yourself in an overall good state of health.